Hi everyone, I am Asha, the student of ARIP Charusat University, and today's my topic of presentation is Effect of Feedback in Motor Learning. Uh, as we all know what is feedback, and in our clinical setting, we used to give feedback to the patient. So, my aim of presentation here give you the information regarding the types and characteristics of feedback and how it is influencing the motor learning. So, the objective of today's presentation is to know about what the types and characteristics of feedback and what is the role of feedback in motor learning. Starting with what is the feedback? Feedback is any information which is received by the learner before, during, or after an attempt to perform a task. The information is quality or quantify the performance. And lastly, the feedback has a very important role in guiding the process of motor learning. Time to discuss the types of feedback. There are mainly two types of feedback, intrinsic and extrinsic. Let's start with the intrinsic feedback. Here in the intrinsic feedback, what the performer felt while performing the task or while performing the task. The information is received by visual, auditory, proprioceptive or the tactile nerve. Let's move to the second feedback, extrinsic feedback. The extrinsic feedback is received by the external source. Example, in the clinical setting, the therapist provide extrinsic feedback to the patient. In the sports, coach provide the extrinsic feedback to the players. It should be given by the knowledge of results and the knowledge of performance. The extrinsic feedback is also called the augmented feedback because it is enhancing the task intrinsic feedback. Let's discuss what is knowledge of performance and what is knowledge of result. Starting with what is knowledge of performance. Here, it conveys the information about the movement characteristics, how the movement is performed. Example, in our clinical setting, we used to tell patient how you should lift the bottle or how you should drink the water. In knowledge of result, we are giving information regarding outcome related information context to performance, how successfully the skill is performed. Example, how successfully patient is drink the water, or how accurately the patient drink the water uh, compared to the previously or the day before. Let's discuss the most important part of the presentation, the characteristics of augmented feedback. There are various characteristics of augmented feedback. Here we are discussing the method of presentation, movement variable, focus of attention, timing, frequency, and autonomy. Start with the method of presentation. There are various methods of giving the feedback, but we usually use visual and verbal. Moving with the movement variable, it should be internal or external. Example, in internal, we are focusing on the angle of joint movement or angle of elbow or the bicep muscle activity. In external, we are focusing on the speed to complete the task. Moving to the focus of attention, it is also two types, internal focus and external focus. In internal focus, our focus of attention should be on the body movements. Example, while patient is walking, we are oftenly tell to patient to bend the knee. Here, the focus of attention should be on the body movement. So, it is called the internal focus of attention. In external focus of attention, the focus of attention should be the movement effect. Example, if we put the obstacles in the walking and we are telling patient to not to touch the object. So here the focus of attention should be on the object. So it is called the external focus of attention. Moving to the time. Concurrent feedback. In the concurrent feedback, we are giving constant feedback to the patient. The terminal feedback, after completing each trial, we are giving feedback to the patient. And in the summary feedback, after completing the whole task, we are giving feedback to the patient. Frequency, consistent feedback. Here, the name suggests we are consistently giving the feedback to the patient. Bandwidth feedback. Here, we decided the range of correctness. If the feedback if the error should be going beyond the range of correctness, then only we are giving feedback should be provided to the patient. Block feedback. Here, for first 10 trials, we are giving feedback to the patient, and after 10 trials, after 10 trials, we are blocking the feedback for next 10 trials. So it is called block feedback. In the feedback initially we are giving the high guidance feedback to the patient, and along with the time, we are reducing the feedback. Lastly, autonomy. Here, patient has to, it is ability to decide to take feedback or not. In the active, the patient decide he wants a feedback, he wants or not the feedback. And in the passive, therapist decide to give feedback to the patient or not. Along with the time, the role of feedback in learning change continues with the time. And for better understanding, I divided this view into the three: early, second phase, and the current phase. Starting with the the learning has the feedback has only a reinforcement role in the motor learning. Adverse law of effect given, the action should be repeated if it is a pleasant effect, and it should be avoided if it is an unpleasant effect. The 1964, the feedback has only the informational role in the motor learning. Practice without the feedback has faded the goal movement pattern and weakened the memory representation. And frequent and immediate feedback has enhanced the motor learning and stronger the memory representation, and it is supported by the Adams and Schema's theory. But it is very early question in 1980. So in 1984, the Salmoni and the Smith had uh, told that the frequent and immediate feedback has a very short-coming result, and there is a decreased retention, that is decrease of retention and the transfer taste. And Salmoni also given the guidance hypothesis, which that the feedback has a role in correctness of the movement. They also told that the frequent feedback has a neglecting effect in intensive feedback. Intensive feedback is necessary for detecting the error and correctness mechanism. Due to the frequent feedback, there is excessive variability in the learning, which will interfere in the movement in the inherent variability in the motor system, which shows that is a detrimental effect of the frequent feedback for motor learning. When there is a when there is a when there is reduction of frequent feedback, it shows a better motor learning. In bandwidth feedback, there is a decrease of movement variability, and which will shows the better motor learning. When we are comparing the delayed feedback and active autonomy with the frequent and immediate feedback, the delayed feedback and active autonomy has better outcome compared to the immediate feedback. And there is a converging evidence for to tell that the feedback has not only the informational role, but it also has the motivational role. Moving to the current research, it consistently shows that external focus of attention instruction has better motor learning comparing with the internal focus of attention. Because in the internal focus of attention, uh, there is a conscious mode of control, that is increased conscious mode of control, which eventually decrease the motor learning. So the external attention of focus instruction are more better than internal focus of attention for motor learning. Feedback after a successful trial. Feedback after a successful trial had a positive effect on intrinsic motivation, and which will eventually lead us a better learning compared when it is given to the poor trial. Lastly, the social and the comparative feedback. When there is a favorable comparative feedback is given with a competence of result, it shows improve in self-efficacy and the motivation, which eventually lead us a better learning. Comparatively, same if it is given negative comparative feedback, it decreases self-efficacy and decrease the motivation, which will lead a decreased performance in the motor learning. So I would like to summarize here. We discussed the types of feedback, intrinsic and extrinsic, and we also discussed the characteristics of feedback, like method of presentation, timings, frequency, attention of focus, autonomy, and lastly we see the change in review in the role of feedback. Thank you.